Update on COVID-19 in Oregon. I'm joined by Patrick Allen, Director of the Oregon Health Authority, Dr. Dana Harganani, OHA's Chief Medical Officer, Barry Pack, Director of the Oregon Lottery, and Dr. Ashby Monk, Executive Director of the Global Projects Center at Stanford University and co-founder of Long Game Savings. Well, Oregon, I'm pleased to say that together we have made real progress at tamping down COVID-19 after we faced the last surge. Our hospitalizations today are at 285, the lowest they've been since April. 6 counties have vaccinated 65% or more of their residents 16 and over, and statewide, we're now at 63% of adults vaccinated. Every single day, we are getting closer to ending this chapter of the pandemic. With summer just around the corner and life starting to return to normal, I think we're all feeling excited and hopeful that good days lie ahead. But we aren't there just yet. In this final push to reach every Oregonian with a vaccine and to meet our goal of at least 70% of adults vaccinated so that we can fully reopen our economy, we will need to pull on every lever we have. So if you've been waiting to get a vaccine or you just haven't gotten around to it yet, we're going to give you an extra incentive. How about a chance to win $1 million? Take your shot, Oregon. Roll up your sleeves and get a chance to change your life. We are encouraging all eligible Oregonians to get vaccinated for the chance to win money and education scholarships. All Oregon residents who have received a COVID-19 vaccine will be entered in the Take Your Shot Oregon campaign and are eligible to win. There will be $1 million winner for residents 18 and over. 5 $100,000 Oregon College Savings Plan scholarship winners for Oregonians ages 12 to 17, and each of Oregon's 36 counties will have a $10,000 winner as well. All Oregon residents who've received at least 1 dose of their vaccine by June 27th will be eligible in our Take Your Shot Oregon campaign and entered to win through our state vaccine database. That includes a first dose of Pfizer or Moderna or the Johnson & Johnson vaccine. With help from the Oregon State Treasury and the Oregon Lottery, the Oregon Health Authority will conduct a drawing to randomly select the winners in each category. Winners will be notified and able to claim their prize or opt out if they prefer. The drawing will take place on June 28th, with winners announced the following week. Getting vaccinated not only protects you from COVID-19, it helps protect your loved ones. It takes us one step closer to unlocking the restrictions we have endured during the pandemic. And in Oregon, it now gives you a chance to win $1 million. That sounds pretty good. And right now, getting vaccinated is easier than it's ever been. Local public health and community-based organizations are partnering with healthcare providers to improve access to our most vulnerable neighbors. There are pharmacies, community clinics, and medical offices across the state that have available appointments. For example, just this week, the Oregon Convention Center, one of our mass vax sites, celebrated that they have given 500,000 shots. You can walk in and get a vaccine even without an appointment. If you still have questions about getting the vaccine, go ahead and get your questions answered. Call your healthcare provider or drop by your local pharmacy and ask the pharmacist. Our website, covidvaccine.oregon.gov, also has great resources and information. We can do this. I'm encouraging every eligible Oregonian to take your shot. Go get vaccinated. It can save your life and just maybe make you a millionaire. I've invited Dr. Ashby Monk of Stanford University and co-founder of Long Game Savings to join us today. He has over 2 decades of experience designing decision-making processes to help people make smart choices. He'll be sharing more about the data and research behind incentives like these. We are really grateful for his work over the past few weeks with our teams to get us here today. So with that, Dr. Monk, the floor is yours.
Thank you so much, Governor Brown, for this incredible opportunity. First of all, thanks to the whole team at Oregon for the chance to work on this project. When Governor Brown and Treasurer Reed's teams reached out to me back in April and asked if I would consider brainstorming creative ways to motivate people to get vaccinated, I think I may have literally jumped out of the chair I'm currently seating in. I was just incredibly excited to volunteer my time and share all that I know about this issue of motivating people and organizations to make complex, important decisions. That's what I work on, helping them do what's important for them and for society. I've been doing that, as the governor said, for about 20 years, designing decision-making processes to help people and organizations make the smart, the positive, and the effective choices. We want these choices to be made in their self-interest, even when there might be confusion or anxiety or even fear. In these cases where people are afraid about an action or a decision, we've learned that messaging that is based on fear, such as showing the negative consequences of not doing some action, or even the messaging that is sometimes rational, arguments about the science or education, these can struggle to get through to those individuals who are feeling the anxiety and the stress. It's tough to cut through. Many of the researchers and academia with me, we've found one tool, surprisingly, is incredibly powerful, and it's games. Games, and I should say variable reward incentives. These incentives are powerful, such as raffles or other games of chance. Today, games and variable reward incentives are really at the cutting edge of the science of motivation. My guess is many of the people on this Zoom are already using gamification techniques right now to help you make tough decisions and improve your lives, to help you eat right by tracking your food calories and leveling up every day, to work out more, competing against your friends through different applications, study longer. I use it to sleep better. The academic research backs all this up. Games increase extrinsic motivation across a range of difficult and different decision contexts. And I can tell you from my work over the last 5 years that the notion of prize-linked savings programs, these are programs where we actually award people raffle tickets when they save money. They make a positive step in their personal finances and they win cash prizes for doing so, is incredibly successful. Please forgive the academic for citing research, but I have a couple of papers that I think clarify this incredibly well. In fact, a very recent one written by Gertler and co-authors in 2021 that showed a randomized prize-linked saving experiment. It was across 110 bank branches. The number of new accounts opened increased by 41% in the months when there was a raffle for cash prizes. The opportunity to win a cash prize boosted uptake of new savings accounts by 41%. And it gets better. To me, this is even more exciting. Nearly all of those savings accounts, 96% of them, were opened by people that would be prior described as unbanked. They had no banking relationship up until that point. And the chance at winning a cash prize drove these people to do something they had never done before. If we can get this kind of uptake from games for the unbanked, there's reason to be quite confident that we can use the same mechanism to motivate the unvaccinated. And there again, have patience with the academic on the call here. I can cite another academic study that shows that games, and this paper is in 2020 by Montagny and co-authors, games are been shown in vaccines to enhance vaccine knowledge and improve vaccine uptake. Games drive the behavior that we would like to see. There's tons more data that I could pull to, and I'm happy to do so in questions or after the conference. But I think the punchline is this: incentives that can change your life with big financial rewards really do inspire large groups of people to take positive action. If we can get 20 to 40% more of the people in Oregon to choose to get vaccinated among the hesitant or the population today not prioritizing getting the vaccine, I think we could save many lives, many lives. And so that's why I jumped out of this chair to work on this project, but I quickly got back into the chair to begin writing a proposal for Governor Brown. And I have one final thought, and then I'll turn it back to you, Governor Brown. I'd like to do a shout out for the history buffs out there. I will tell you that this is not, the COVID crisis would not be the first time that a government used a variable reward incentive program or a game to confront a serious or even an existential threat. In 1695, the English government used a game called the Million Adventure to raise funds for their war against the French. The government sold 100,000 tickets for £10 each. Each ticket afforded a person a chance to win a generous, life-changing prize. The game was hugely successful. Even people that couldn't afford to participate pooled their savings to get into what they called at the time syndicates to play. The government got the money they needed to fight the war. The people were more than happy to give up their cash in the short run with the promise of getting paid in the long run. And so, as a final thought, my hope is that 3 centuries later, Oregonians, I hope, will come together like the English did. They'll drive each other to get vaccinated. They'll form a syndicate, and the community can come together, take a shot, Oregon, and win enough money to change your lives. So with that, thank you very much. And I'll turn it back to you, Governor Brown. Thank you.
Thank you so much, Dr. Monk. We certainly appreciate the history lesson and your time and your enthusiasm. And with that, I'm going to turn it over to Director Pat Allen of the Oregon Health Authority. Director Allen, the floor is yours.
Thank you, Governor Brown. Again, I'm Patrick Allen, Director of the Oregon Health Authority, and I'm joined today by Dr. Dana Harganani, our Chief Medical Officer. As we get ready to see the first counties in Oregon move to low risk after they reach the 65% vaccination target, I want to provide some brief updates on our progress against the pandemic and the growth we've seen in vaccination rates. First, recent trend data clearly show the latest COVID-19 surge is waning. Over the past week, we've seen a 16% drop in newly reported cases each day, marking the second consecutive week cases have fallen. Our 7-day moving average for daily cases is 486, which is 40% lower than it was on May 1st. These numbers are consistent with the modeling report Dr. Seidlinger, our state epidemiologist, released last week. That model estimated that transmission rates had fallen below the level the virus needs to spread at a self-sustaining rate. The drop in new cases is in line with that forecast, and this turning point is likely due to multiple factors. Extreme risk protections pumped the brakes in counties with the highest infection levels. Warmer weather invited more people outside. Most Oregonians continue to wear masks and limit the size and frequency of social gatherings, and most important, more Oregonians have been getting vaccinated every day. However, hospitalizations and deaths, which are both the most severe and tragic outcomes of COVID-19 and the last indicators to change, remain high. Over the past week, Oregon recorded 57 COVID-19 deaths. That number is the highest total in 10 weeks, and it's a grim reminder of the threat COVID-19 still poses to the lives of Oregonians of all ages. We're reporting the loss of 7 more Oregonians today, and my deepest sympathies go out to their families and friends. As of today, there are 285 COVID-19 positive patients in Oregon's hospitals. We've declined significantly over the past week and since the beginning of the month. Nevertheless, hospitalizations are still too high, continuing to stress doctors and nurses in ICUs across the state. But it's encouraging to see them coming down. I also want to note that hospitalizations for African Americans have spiked in recent weeks. We cannot let an overall downward trend mask a disturbing development for a community that's been hit especially hard by COVID-19 all across the country. We're working with community organizations and local health officials to speed vaccinations for African Americans in Oregon and prevent more cases of severe illness in the community. As we try to stamp out the virus, we continue to see increases in our most effective tool to end the pandemic, vaccinations. Let's look at our latest vaccination numbers. Oregon's vaccination totals continue to grow. We remain on track to pass Governor Brown's target to vaccinate 70% of adult Oregonians before the end of June. 63% of Oregonians who are 18 or older have received at least one vaccination. More than 2.1 million Oregonians have received at least one dose of a COVID-19 vaccine. According to the latest data, 1,656,783 Oregonians have been fully vaccinated. Oregon vaccinators have now administered at least one shot to 52% of our total population, according to the CDC. Oregon now ranks 19th in the nation, including the District of Columbia, in the percentage of our total population who have received at least one dose. The national average is 48%. As of yesterday, Oregon is averaging a total of more than 29,000 first and second doses each day. Most important, we're continuing to see the rate of vaccinations pick up among communities of color. Over the past week, the rate of change for African Americans was nearly 9%, and for Latinos and Latinas, it was 7%, while for whites, it was just under 5%. That's an encouraging sign that our partnerships with the community are continuing to expand vaccination opportunities and build confidence among communities of color. Over the past week, our total statewide percentage change for everyone 16 and older was 1.3%, which was down from the prior week. But that figure was affected by an abnormally low number of vaccinations on and around Mother's Day. The numbers have picked up again recently. As of now, we remain above the rate we need to reach the targets Governor Brown announced last week. As you know, we plotted scenarios that took into account our current growth rates and any potential drop-offs of 10, 25, and even 50%. Under all our current scenarios, Oregon is on pace to vaccinate 70% of adults before June 27th, at the latest according to those scenarios. As we track Oregon's vaccination targets, let me clear up some confusion about the numbers we're using to calculate this metric. We're using the CDC's calculation of the percentage of people who are 18 and older to track our progress toward our state level target to vaccinate the 70% of adult Oregonians required to lift risk metrics. We do this for a couple of reasons. First, the CDC data offers a more comprehensive, complete, and accurate picture of total vaccinations in Oregon because the federal data includes vaccines administered by the Veterans Administration, Indian Health Service, and other federal entities. The CDC data also enables us to track our progress against the goal the Biden administration has set for the nation. The CDC data is less reliable at the county level because it doesn't always include the county of residence information for people who are vaccinated through those federal entities. For county vaccination rates, we'll rely on Oregon's Alert Immunization Information System. In the past, CDC reported all eligibles in their data reports, which included 16 and 17-year-olds with adults. That's why you've seen some definitions of our statewide 70% vaccination target refer to 16-year-olds. CDC's data reporting categories changed when older children between 12 and 15 became eligible to get vaccinated. Now CDC's report for people who are 18 and older only includes adults. Now let's talk about our county targets, where we're also continuing to see progress. On Monday, 5 counties became the first in the state to move into lower risk after vaccinating 65% of eligible residents with at least one dose and submitting vaccine equity plans to OHA. Those movements to lower risk took effect today. Those counties are Benton, Deschutes, Hood River, Lincoln, and Washington counties. That's an exciting milestone in this pandemic. And as I said last week, the diverse range of population sizes, geographies, urban, suburban, rural, and coastal mix of these counties shows that every Oregon county has the capacity to reach the 65% target. Looking ahead, we know other counties have reached the 65% threshold since last week, or they are on pace to do so. Multnomah County is now above 65%. Lane, Polk, and Tillamook counties are near 60% or above. We look forward to working with these counties and every other county in Oregon to support their equity plans and help them reach the 65% target to move to low risk. There are many reasons to get vaccinated. We know from national surveys and surveys we've conducted in Oregon that more and more people are choosing to get vaccinated. For many people, the question hasn't been whether to get vaccinated, it's when they can fit a COVID-19 vaccination into their busy lives. I believe the incentives Governor Brown announced this morning will encourage many Oregonians to prioritize getting vaccinated in the coming weeks. Getting vaccinated is a very personal decision, but it makes a big difference for you, the people you care about, and everyone around you. Oregon is closing in on our 70% vaccination goal, which will allow all of us to return to a more normal life without the restrictions and limitations we've had to rely on to fight COVID-19 for the past year and a half. To find out where to get a vaccine or get answers to your questions, go to covidvaccine.oregon.gov and make your plan to get vaccinated. With that, I'll turn it back to you, Governor Brown.
Thank you, Director Allen. Charles, we're ready for questions.
Thank you, Governor. Our first question is from